Welcome to this channel. Myself Dr. T.N. the Doctor of Modern Medical Science, Motivational Speaker and Life Coach. In this video, I'll talk about one of the important topic in psychiatry, that is illness anxiety disorder. Previously, it was known as hypochondriasis. Though it's look very simple from the psychiatric point of view, but for the patient it is very much distressing, as well as for the family member. It is very burden for this family member, because this patient having IAD, illness anxiety disorder, which is primarily a disorder of the anxiety, where patient think they have a disease or they will develop a serious disease because of some physical symptoms. So patients are preoccupied with the false belief that they have or they will develop a serious illness, though all the lab reports and the CT scan, MRI and other reports are normal, and they have done it repeatedly. Again they want to insist to have CT scan and MRI, but all the reports are in normal range. Now, what is the psychopathology? Why it is happening? Why patient have that much of health anxiety? Because of three important reasons. Number one, disease conviction. Disease conviction means the patient has a belief that he or she has a serious illness or disease fear. There is an extreme worry for the developing of serious illness, which patient leads to patient have very distress. And there is bodily preoccupation. That means the symptoms which are very benign in nature, but they perceive as an abnormal sensation, and they start doing intense scrutiny to identify the warning signs of any illness. Now, the fear of sickness persists despite there is absence of symptoms or signs or any positive lab test. That means lab tests are normal, clinical signs are absent, but there are some symptoms which are very benign in nature, but the patient perceived as very serious. Now, difficulty is that some patient can understand that there is no illness, but they remain very worried and very feel that they are helpless. But some patients are there where they actually don't understand the nature of the illness, that actually he does not have illness. He cannot separate himself from the illness. Now, maladaptive illness behavior, that is how he will recognize the symptoms, what he will do. Whenever there is symptoms, he or she will repeatedly, they will do self-examination. They will seek reassurance, and that reassurance has to be repeated again and again. They will require reassurance, and they start searching the symptoms in the internet, and they get lots of knowledge or information, and they get more worried. Remember, it is very dangerous for the patient and very troublesome for the therapist also. And there is a new term called cyberchondria. Like hypochondriasis, there is cyberchondria. That means there is excessive search on the internet for the symptoms. Now, misinterpretation of the bodily symptoms will lead to distress and anxiety, because you will have the fear of having serious disease or will development of serious illness. How you will see the clinical finding in this patient? There will be frequent visit to doctor, frequent consultation to various doctor, request for testing CT scan, MRI and other tests. They always go for request that they need to do all this investigation, and intense health checking behavior is also sometimes come under the form of hypochondriasis or illness anxiety disorder. And you will find that there are more days of work loss, or even in the student they may have year drop for these illnesses. Now, we need to identify that illness anxiety disorder is not generalized anxiety disorder, is not a panic disorder, is not a OCD disorder, or is not a somatic symptoms disorder, and we need to differentiate from all these symptoms, and we'll talk about this slide in later. Now, we have to assess if there is any illness. If there is any depression, or is there any anxiety, or is there any post-traumatic stress disorder. So we have to have questionnaire for the symptoms of depression, we have to have anxiety, mania, psychosis, OCD and PTSD. We have to rule out all these things. Now diagnosis, if you follow the DSM-5, this says there has to be 3 symptoms. All symptoms mean 3 symptoms for more than of 6 months. What are that symptoms? That symptoms is that preoccupied with having a disease or getting a serious illness without any appropriate reason, and anxious about that belief that they will develop some disease, and there is excess health related behavior, either it is care seeking or care avoiding. If all these 3 symptoms are persisting for more than 6 months, then only you can diagnose that patient has hypochondriasis or illness anxiety disorder. Now, if you see the differential diagnosis of this, generalized anxiety disorder, usually they complain of headache, GIT distress, and there are muscle tensions in the body. But usually in hypochondriasis or illness anxiety disorder, usually they are not so prominent. They are more prone, they are more in favor of making the diagnosis, go for the other investigations. Panic disorder, there will be intense feeling of death, which usually absent in case of hypochondriasis. OCD is a worry of contamination, that contamination will develop some serious disease. We have to differentiate. And somatic symptom disorder, where patient wants to have relief from the somatic symptoms, but in hypochondriasis or illness anxiety disorder, they are more in touch of making the diagnosis. Now, what is the natural course of the illness? Natural course of the illness, usually if you see the age of the onset is usually early or middle adulthood. That means at the age of 18 to 25 years, you can have all these illnesses mostly, but it can happen at any age. Disorder is often chronic, it has a long course, and remission is associated with when there will be remission or decrease the symptoms. When there is less disease conviction that he has or he will develop, if the conviction is less, there is chance that the prognosis will be better. If there is fewer somatic symptoms, if number of symptoms are less, then definitely prognosis is good. If there is higher level of functioning, because we have seen some students, they have to have 1 year drop in the exam because of these illnesses. If the functioning level is very much poor, then definitely prognosis will be poor. And if you see the less disease fair and fewer disability days at the baseline, that means the day he has wasted for these illnesses is less, then the prognosis is good. And definitely if there is any other comorbid illness, psychiatric illness, then definitely the prognosis will be poor. Now, what is the neurobiology? What actually happens? In neurobiology, there is decreased activity of the circuit that involved in the dorsolateral prefrontal cortex, striatum and left thalamus. These are the parts of the brain. There are connectivity, and if there is any problem in the connectivity, the decreased activity of these connections, there will be development of illness anxiety disorder, as well as the increased activation of the amygdala, because it's related to our emotions. Hypoactivity of the brain region, which actually important for the planning and executive function, and as well as increased activity of the region involving the anticipatory fear. Now, fear, the area which anticipate the fear, if it is increased activity, and where there is hypoactivity, less activity in the region of planning and executive function, that are one of the important finding in case of illness anxiety disorder. Finding, if you see, it almost looks like similar that of OCD and panic disorder. Now, if you take the Stroop test, for the words related to is distressing bodily sensation, they will take longer response time. And associated with increased activation of the several frontal, temporal and subcortical structure. And there are some specific circuit which actually responsible for visceral sensory sensory processing. That means the sensation you get, it has to be processed by some circuit. If there is any abnormality in this circuit, which actually comprise of insula, anterior cingulate cortex and periaqueductal grameter. If these are the three important structures which actually process the sensory functions, if there is any abnormalities, then definitely there will be more anxiety related to health. Now with this, there will be increased negative expectations, negative attentional bias and catastrophization of the bodily sensation. Negative attentional bias means the symptoms, they give more attention to that, and there will be negative attentional bias. And there is no biomarker for the illness anxiety disorder as of now. Now this is the very important and very crucial for the treatment of illness anxiety disorder. We have psychopharmacology definitely, and as well as the psychotherapy. Now the beauty is that is one of the important diseases where psychopharmacology is equivalent to psychotherapy. The result you will get in the form of, after giving the drugs, it will be equivalent if you give only psychotherapy in the form of cognitive behavioral therapy. There are several studies where they have shown that fluoxetine, paroxetine and CBT is almost give similar responses. Okay, so fluoxetine and paroxetine, one of the these are the important drugs we can use in this illness anxiety disorder, and there are other drugs also. And it has been seen, if the patient has taken a long-term treatment and long-term follow-up, it has been seen around 60% of the patient they have reduced the symptoms and they are no longer meet or fulfill the criteria to diagnose as illness anxiety disorder. That means treatment has a response or psychotherapy has a response. There are large randomized control trial in 195 patients, and it has been seen fluoxetine is slightly better, 44.4%, where CBT is 39, that means almost 40%. So almost comparable efficacy of the SSRI as well as the CBT. And as well as paroxetine and CBT, they are equally effective. Now psychotherapy, this part is very important. If you want to treat the patient, that is the basis of this treatment, because we need to change the thought. We will discuss in the CBT. Now CBT is equally effective and CBT is cost effective, and there is no side effect of the medication. And we focus in misinterpretation of the bodily symptoms. That is very important. How patient misinterpret his or her bodily symptoms, we have to target on there. We have to identify the maladaptive behavior and cognitive pattern, how he thoughts and how he behave. We have to find out this maladaptive behavior pattern and generation of alternative explanatory model for the symptoms and psychological distress. We have to find out other models for explaining these symptoms and his psychological distress, why it is happening. We have to explain in a different model. Now CBT, it can be individual CBT, it can be group CBT, or it can be internet based CBT, and both are effective. All are effective, equally effective rather, all are effective. And treatment benefits sustained 7 to 24 months, and symptomatic improvement is there, no doubt. Individual mindfulness clinic, that is one of the very important aspect in treating the illness anxiety disorder. Mindfulness based cognitive therapy we have to give, and it has a very good result, where we focus on mindful awareness of the thought. Now what kind of thought he has having, we just aware about this thought and changing in individual relationship with these thoughts. Rather we stop the thought. No, we didn't advise to stop the thoughts. Rather we can allow to aware about the thought and to detach himself or herself from this thought. This is one of the important. And short-term psychodynamic psychotherapy is not that effective of CBT. CBT is very much superior. We can also give behavioral stress management and explanatory psychotherapy, how it is happening. So these all are very important and very necessary to treat this illness anxiety disorder. Now, beyond this scope, we will discuss something which is really important. It is how you are communicating with this patient of illness anxiety disorder. It is very important because these patients are very frustrating. Because discussion with the patient is very important, because some of the patients, they don't have any insight about this illness, and we need to understand their model of explanation, how they explain, how they relate the symptoms with the illnesses. We need to understand their model of expression, and we need to be very empathic, adopting an active and curious attitude to their experiences, to understand their experiences. Even if you know, but you have to show that you are very curious to know their experiences. And to avoid conflict, one might tempted agree with the mistaken belief. That is wrong. Whatever the situation, we should not go with this maladaptive or misinterpreting or mistaken his belief. Like blood count for leukemia. We cannot advise blood count repeatedly for leukemia, because it is not wise or advised to have a agreement with this patient mistaken thoughts. Okay, if you take that, if you take or agree with this erroneous thought, then later on it will be very difficult for the practitioner to find out or to match his or her expectation. It is very important. So although it is very hard to avoid the patient appointment frustration and feeling of rejection, that practitioner is unable to give the proper diagnosis or proper reassurance, right? But at that point of time, the therapist has to be very careful about the counter transference, because sometimes we say, doctors say, or your therapist say, avoid blaming the patient about the symptoms, because what we say, your practitioner said that is this all in your head. The whatever you are having the problem, it is not your bodily symptoms, not your cancer, not your, it's all about your head, all about your head. But this kind of statement is not a very empathetic treatment, remember, and nor it is therapeutically useful. Rather, we should avoid this kind of statement. Now, documenting the diagnosis of illness anxiety disorder, it is very important, because once we diagnose as illness anxiety disorder, it is very much trend that some of the physician or next physician, if there is any complaint, we try to explain as an illness anxiety disorder. So the most important point here, once patient is diagnosed as illness anxiety disorder, it does not mean we should ignore all the medical problems of his or her. Now, conclusion. It is a disorder of the anxiety. Remember, it is a disorder of the anxiety. Differential diagnosis, we have to consider the most closest diagnosis of somatic symptom disorder, and we can differentiate it from somatic symptom disorder by lack of somatic symptoms in hypochondriasis. Usually somatic symptoms are less, and they don't come for the symptoms relief, rather they come for the diagnosis. CBT and SSRI, both are equally effective. If you can combine both CBT and SSRI, the response is very, very effective. Avoid unnecessary testing. Whatever patient may suggest you, patient may insist you, but it is our duty to avoid all unnecessary tests. Avoid viewing the patient with that is the important point, that we should not consider that patient that he is dismissive. That means he is not worth of considering seriously, right? Or he does not have any value in this attitude. We should avoid it. We should avoid this kind of attitude. Okay, this is all about illness anxiety disorder. I know it is not the complete, but it will give you a definite insight about illness anxiety disorder. Thank you so much. You can subscribe my YouTube channel, as well as you can subscribe my app Dr. T. Ndebnath from the Play Store. Thank you so much.